Assalamu alaikum, I'm Dr. Abdul Hakim Jum'a, and I'll tell you everything you need to know about the Ebola virus. A severe, often fatal member of the filovirus family causes Ebola. Since Ebola virus disease was first identified in 1976, it has caused several self-limiting outbreaks throughout Africa. The previous outbreaks are considered self-limiting in that despite incomplete disease control resources and the absence of a vaccine, none of the previous outbreaks were sustained for more than 5 months. Transmission of the virus between humans in the previous outbreaks just stopped. Conclusive evidence was never found to inform physicians and researchers as to where the virus originated. It is suspected that there must be an animal, such as a bat or a primate, that hosts Ebola virus but is not easily killed by it. Therefore, we can say that the reservoir for the virus is currently unknown. In December of 2013, a new epidemic emerged of Ebola virus from the West African country of Guinea. Since then, other countries where the virus has been confirmed to have been transmitted between humans include Liberia and Sierra Leone. While past outbreaks had a case fatality rate of up to 90%, the current West African outbreak kills about half those who are infected. There is currently no treatment and no vaccine. In order to prevent the disease from spreading in populations, it is critical that the disease be identified early. The Ministry of Health has provided guidelines for identifying suspected and confirmed cases of the Ebola virus. A case of Ebola is suspected in a person who has both consistent symptoms and risk factors. These are as follows: travel history and recent contacts. Has the person in question recently come from a country with a high rate of infection, or spent time with a traveler from one of these countries? Clinical criteria, which includes a fever of greater than 38.6 degrees Celsius, and the additional symptoms such as severe headache, muscle pain, vomiting, diarrhea, abdominal pain, bruising, or unexplained hemorrhages from the rectum, mouth, nose, vagina, or puncture sites. And epidemiologic risk factors within the past 3 weeks before the onset of symptoms, such as contact with blood or other body fluids of a patient known to have been suspected of Ebola virus. A confirmed case is a suspected case with laboratory-confirmed diagnostic evidence of Ebola virus infection. Ruling out other potential causes of these symptoms must also be done simultaneously while testing for the Ebola virus. For example, malaria diagnostics should be part of initial testing because it is a common cause of febrile illness in a person with a travel history to the affected countries. This Hajj season, people traveling from West Africa will be spending time in close contact with many others at the holy sites. Though people from Guinea, Liberia, and Sierra Leone have not been granted passage to the Kingdom of Saudi Arabia this year, carriers may still be present. Knowing the case definitions for Ebola virus will help you and the healthcare team to accurately and efficiently identify suspected cases of the disease.